Hi, good morning Marco. My name is Mihiraa. I'm your invigilator for the OIT speaking session on the 16th of March 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Marco Pablo.
And what is your candidate number, please?
My candidate number is 286309192.
Thank you. And, you are taking this test, as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So, let's start with warm-up questions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you handle disgruntled patients?
I think unhappy patients are part of the job. After all, they're the ones who are suffering the most in this situation. That's why I try my best to calm them down and get their perspective on the situation. Listening to them patiently and understanding the root cause can help to get rid of such situations. I consider it as part of my treatment.
What do you love about nursing?
Nurses are like mediators between the multiple disciplines in a healthcare setting. At times, we might work in the background, but we're valuable to the team because we bridge the gap between the patients and doctors. I have always been a people person, so I like being the spokesperson for both participants. It gives me great gratification to assist patients and help them understand their diagnoses.
Where do you see yourself in the future?
I hope, by that time, I have acquired the skill set and the experiences required to be considered the best in this field. My long-term plan is to become a supervisor and join the administration department. I feel that the job will allow me to contribute on a bigger scale. However, even if I don't become a supervisor by then, I'd still be happy to know that I have pushed myself in this career and continue to save lives.
What is your greatest failure, and what did you learn from it?
One past decision I always struggled with is not immediately going to college after high school. I am often hard on myself because I tell myself I could have been where I wanted to be already, and I wasted a lot of time. But I learned that discovering your true calling and passion in life isn't easy and requires serious thought and time. Essentially, I learned that I should be passionate about everything I do and never do anything for the wrong reasons.
How do you handle unexpected circumstances like short staffing, unfamiliar treatments, etc.?
I take a step back, analyze the situation, and determine the most appropriate plan of action. If we are short-staffed and have to take an extra patient, I will modify my plan and focus on my priorities. If I have to give an unfamiliar treatment, I consult any available materials, such as nursing policies and procedures or manuals, or ask for help. Whatever the circumstance, I welcome a challenge and always make learning my main priority.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Marco Pablo. I am one of the registered nurses from the Community Health Center. For confirmation, am I talking to Mihiraa?
Good morning. Yes, I am Mihiraa.
Hello Mihiraa, nice to meet you.
Nice to meet you, nurse.
I am here to check on your progress following your right hip replacement. Tell me, Mihiraa, how are you doing after the hip replacement?
I am feeling better, and walking is much more effortless now.
That's good to hear, Mihiraa.
Well, nurse, I am feeling tired though, as I have been sleeping badly the last few nights.
Oh, is it? Well, Mihiraa, can you elicit the possible reasons for your poor sleep?
Actually, nurse, I am not anxious or stressed. But I have headache for a few days, and my face feels a bit painful. Also, I had a cold last week, and my nose is badly blocked, which is disturbing my sleep.
I am sorry to hear that. Can I ask you a few questions that will give me more insight into your headache?
Sure, you may please ask.
Thank you, Mihiraa. I would like to know the severity of your headache. How would you rate your headache on a scale of 1 to 10, where 1 is the least pain and 10 is the worst pain you ever had?
Definitely, nurse. The headache is bad, about 7 out of 10, I would say.
Sorry to hear that. May I know whether your headache gets worse when moving?
Yes, I feel it gets worse when I lean forward.
Okay. Do you have a fever associated with this?
No, I don't have a fever.
And what about the change in appetite?
Nurse, I am eating less, as chewing hurts.
I understand that. And what about the loss of sense of taste?
Yes, nurse, I have lost my sense of taste, as well.
All right. Thank you for answering my questions. Mihiraa, try not to worry. From your words, the symptoms suggest acute sinusitis, which is inflammation of the sinus lining at the back of the nose.
Okay. Is it something serious?
This is a prevalent condition, which is usually self-resolving, and not a serious issue. So, no need to be panicked about it.
All right. How to get rid of it?
Now, I will recommend some self-help treatments for your condition.
Okay. It will be of great help, nurse.
Mihiraa, it is recommended to consume more fluids, because high fluid intake will loosen secretions.
Okay. I will do that.
Also, gently blow the nose to clear the sinus. And try to keep your head elevated when lying down.
Sure, I can do that, nurse.
Mihiraa, following my suggestions will help to deal with your condition to a greater degree.
Nurse, I will do what you suggest. But I think I need to see my GP and get a definitive treatment.
Your thoughts are natural. I suggest you see the GP only if there is no improvement in 1 week, so that the GP will prescribe appropriate treatment and also can rule out other underlying conditions, if any.
Okay, nurse.
I reassure you that if you follow my suggestions, you will get cured and can manage your condition much more effectively.
All right, nurse. I will try your suggestions initially. And if there is no improvement, I will see my GP.
That's perfect. Thank you for accepting my suggestions. If you have any queries, always feel free to contact us. Mihiraa, I wish you a speedy recovery.
Thank you, nurse. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.